To the podcast. I'm Dr. Laurie Marbas, and I'm so honored to have Dr. Joel Fuhrman with us today. How are you, sir?
Doing great. Excited to be here and talk to you.
Wonderful. Well, we have two cases from the journal that we want to discuss with you today that you were submitted. And we thank you for your submissions, and we really are honored that you would spend some time with us and share your expertise because you've done so much research in working with patients. But the first one is the efficacy of a plant-based anti-inflammatory diet as monotherapy in psoriasis. And so I think, there is some confusion as to some people maybe what psoriasis is. Could you give us a little background and just explaining what psoriasis is?
Yes, there's more than 100 different autoimmune diseases where your own immune system is attacking your body in some way. And it's related to a degree of heightened inflammation. An autoimmune disease where you attack your skin and develop skin plaques is called psoriasis, but it can be associated with a disease like rheumatoid arthritis. When you have joint pain plus the skin disease, then it's usually called psoriatic arthritis. In this case we're discussing, this person did have joint pain and psoriasis, so she really had psoriatic arthritis, and she also had Sjogren's syndrome, which is another autoimmune disease that gives you dry mouth and dry eyes and other symptoms. She almost had a lupus-type syndrome. Lupus and rheumatoid arthritis and ulcerative colitis and multiple sclerosis are also common autoimmune diseases. And I'm suggesting that in my 30 years of practice, I've had very rewarding and remarkable successes in all those cases with multiple sclerosis, with lupus, with ulcerative colitis, with rheumatoid arthritis, with psoriasis, and with psoriatic arthritis, inducing complete remissions where people did not have to be sick and have those diseases the rest of their life. And we're using this psoriasis case of psoriatic arthritis case as an example, because most of my 30 years as a busy family physician seeing these people, I didn't keep contact and continue to keep the information to be able to want to write these up and write them up as cases, but I've kept in contact with some of these people, and here's a person that I know now because I think she came to me in 2005 or 2006. So this is about 15 years later. And it was a remarkable case because she was so ill and she could hardly move in bed for so long, taking drugs for her psoriatic arthritis, and had such a limited life. And then when that year when she got well and got rid of her psoriasis and her psoriatic arthritis completely, she played volleyball, she played tennis, she climbed mountains. She went away to one of her getaways at the Red Mountain Spa, and she put her arms up in the air and said, "Look at me, I'm a miracle." And I said, "You're not a miracle. This is just what nutritional excellence can do for people, that these are inflammatory conditions." And it seems like a miracle because the conventional medical approach is to give people chemotherapeutic agents to suppress the immune system instead of excellent nutrition to remove the inflammation and to allow the body to resolve these conditions. And I'm excited to be part and to contribute some of these cases to the journal because I really feel that we can definitely, if people they're suffering greatly and they're not being told that there's an option for them to get well here.
Right, absolutely. So this goes back to inflammation. So what is it about a nutrient-dense plant-rich diet that actually decreases inflammation? What mechanisms can people maybe focus in on or understand why this works so well and actually so rapidly?
Right. I think that people understand that the American diet, which is about 60% of calories from processed foods and about 35% from animal products, that both processed foods and animal products do not contain phytochemicals and antioxidants. They just contain what people call macronutrients: fat, carbohydrate, protein, some vitamins, some minerals, but no significant antioxidant load. The small amount of produce that Americans eat, and the Americans only eat 2% of vegetables, is not sufficient to remove the reactive oxygen species and the free radicals that develop. Normal living, normal metabolism, normal digestion produces free radicals when we metabolize calories. But that's okay to produce free radicals and toxic metabolites because the real colorful plant food contains the antioxidants that diffuse and eliminate those free radicals thus produced. Now, when you put fat on your body too, because fat is tissue that's low oxygenated. In other words, fat supply doesn't have a heavy blood supply. So the fat supply produces more free radicals and therefore produces more cytokines and inflammatory compounds. So gaining weight, which of course increases more aromatase enzymes that produce more estrogen, and it can reduce the the breast tissue can have a much higher rate of estrogen to increase aromatase activity than the circulation can. So there's an increased risk of breast cancer, for example, in people that are overweight and have autoimmune conditions. So you have a higher risk of autoimmune conditions in the overweight, but you also have higher risk of psoriasis in people that are not overweight, that are eating poorly, whose genetic predisposition makes them produce more pro-inflammatory cytokines like osteopectin and other things that are markers of inflammation that we can actually measure in today's laboratories that we couldn't do years ago. And with this anti-inflammatory diet, we bring the inflammatory markers down. We bring the osteopectins, osteopontin. I said osteopontin goes down, leukotrienes go down, and of course the HSCRPs, the inflammatory markers go down, and people's pain goes away, and eventually their skin clears and their psoriasis clears. So what I'm saying is that our whole population is overweight. Even people that are moderately overweight, 10 or 20 pounds overweight, could have increased inflammation as a result of their extra body weight. And that extra body weight, in conjunction with their low nutrient and low phytonutrient diet, makes certain people prone to produce more inflammatory compounds and have the immune system now not function normally. And then we have the T suppressor cells that control the activity of the immune system so it doesn't hyperreact. So what I'm saying now is you have a pro-inflammatory state, you have lack of nutrients fueling the immune system, and you're not activating your NRF2 transcription proteins from phytochemical activation. So the NRF2 transcription proteins activate those parts of the DNA that reduce free radicals and remove irritated compounds and fix breaks and damage. So the part of the DNA that's doing the repair isn't activated unless you're activating the NRF2 transcription proteins with enough phytochemicals and antioxidants. And then because of all these things we're talking about, it interferes with function of the T suppressor cells. So when the immune system overreacts, then you can't shut it down. We can't control it. And your own immune system starts to attack itself. And I have to say that I've had many cases that have, not many, but I've had a significant number of cases that have gotten well from lupus. One individual was on a national renal transplant list waiting for a new kidney with a creatinine of 4.2. And we thought, I didn't really think she'd have any chance of getting well, but within a year, her creatinine was down to 0.8 because she was young enough. I think she was probably 17 or 18. Her body was able to fix it, and her kidney came completely back to normal. So what I'm saying right now is this case of psoriatic arthritis is not an independent case. There are other cases with even advanced autoimmune diseases that have made reversal using the same basic protocol.
Wow. So there's a lot of mechanisms, but it comes down to a cellular level inflammation, setting off the immune system, not activating those that can help repair DNA damage and lots of different things there. But if we get out of the way, the body gets better. Just feeding it what it needs.
That's right. If we establish that optimal environment for healing and we get everything right, it's amazing what the body can fix.
It's amazing. So can you give us a little idea of what this is exactly? Because people go, well, what is a nutrient-dense, plant-rich diet? What does that mean exactly?
Well, it means that, we can score even plant foods, especially carbohydrate-rich plant foods. We can score them on a hierarchical scale of quality. The ones that have the most fiber, the ones that are lower glycemic and have the most phytochemicals in them. So we can give a score, of something like cauliflower and beans over something like brown rice or even white potato. And especially we can take white flour and sugar could be even lower than that. So we're trying to have our eating more green vegetables, more non-starchy vegetables that have more phytochemicals in them, and and particularly eating onions and mushrooms with a lot of phytochemicals in them. And then we're eating, of course, a good variety of foods in the diet to get the full symphonic effect from the increased absorption of the lipophilic phytochemicals by having about a half an ounce of nuts and seeds with each meal to maximize the absorption of the lipophilic phytochemicals and the carotenoids that require some degree of fat for most efficient absorption. So, and then we're telling people how to prepare the food to not destroy the nutrients in the preparation process. And that involves perhaps taking the green cruciferous vegetables and blending them before they're heated in a soup base. So they maintain the activity of the myrosinase enzyme to form all those isothiocyanates. You don't cook them in the soup and then blend them to prevent the formation of the isothiocyanates, which are not commonly called ITCs. So these ITCs are important for activation of the NRF2 transcription proteins and for their anti-cancer effects. So it's essentially a diet rich in G-bombs. So G-bombs are, of course, greens and beans and onions and mushrooms and berries and seeds. Other foods too, but we're trying to get a lot of green vegetables, have a salad every day, have a vegetable bean soup, maybe with a carrot, celery, an onion in the base, and put some green vegetables into that and beans. Have the flax seeds and the chia seeds and the wild berries with your morning, steel cut oats or something. Have that wok vegetable dinner, with the broccoli, the Chinese cabbage, with the mushroom, and with the Thai curry, turmeric peanut, sauce on it, whatever it is. In other words, make these recipes taste good, but have the full symphony, the full orchestra of phytochemicals that actually maximally activate human immune function, while at the same time not eating a diet that's high glycemic or that's going to promote too much IGF-1 or insulin-like growth factor 1. And so we're avoiding the high glycemic refined carbohydrates and also avoiding animal products, or at least keeping them to a level that's so low to maintain IGF-1 in a low favorable range that's not going to drive growth or or promote excessive immune reactivity.
Right. Absolutely. Well, you're mentioning all those recipes. It's making me hungry. It's lunch here. So, so that is fabulous. So this particular diet also is obviously similar to what we're going to talk about with your next case series, actually. So we'll move on to that one, unless there's anything else you'd like to say about this psoriasis case.
I just like to say that I know this person personally. I've known her for the last 15 years since she was my patient. And, she'd gone on vacations and she's in great health. She looks terrific. She's enjoying her life. This has been 15 years later, and she's active and doing things she could never do when she's young, that she could ever do when she was young. So she's in her later 60s and she's in great health, and she looks about 45 years old. And she's just in phenomenally good health right now. So it wasn't just that she got well and gained weight back or got sick again. This is years and years later, and she's in superb health, enjoying her life to the fullest.
Right. And that's really what we all strive for, is to get our patients to the thriving level. So she's found her ability to do that, and as will many others. And
she loves eating, and she loves living this life and eating this way, and she loves the food, and she's excited about life, So that's what people see. Like, they see this maybe as deprivation in some cases, some people, because they don't realize their taste buds get stronger. They learn the great tasting recipes, and this is just as enjoyable. And the people who have made these recoveries tremendously enjoy what they're eating and enjoy their life, and that they're in great health right now.
Absolutely, because it feeds each other. So if you're eating well, you feel well, and then you want more of it. So it's an upward spiral, which is amazing. So then we have your three other cases. So we have treatment and remission of symptoms in type 1 diabetes with nutrient-dense plant-rich diet case study. So we have a 3-year-old, there was a 6-year-old, and a 40-year-old. And so basically, you had a 3-year-old that actually, had some type 1 diabetes, a 6-year-old, and then the 40-year-old was a kind of a later onset. Before we dive into those type of cases, can you just tell us a little bit for the audience to understand what's the difference between a type 1 diabetic and a type 2 diabetic, and then insulin resistance and how that can actually affect a type 1 diabetic as well?
Exactly, because that's the really point I wanted to make, which is so critical, is because most people think, the type 1 diabetics are the beta cells in the pancreas have been destroyed by an autoimmune attack on those beta cells when they were younger. So you have no insulin production at all. So you require exogenous insulin. You have to take insulin now. Whereas a type 2 diabetic, they've become overweight, and being overweight and their poor diet has made their body insulin resistant and causing the beta cells in the pancreas to have to overwork to produce excess insulin over the years. And over the years, the overwork on the pancreas makes those beta cells kind of poop out and now can only produce a normal amount of insulin. That normal amount of insulin produced by the beta cells in a type 2 might be enough insulin for a person of a normal weight, but it's not enough insulin for this overweight person. So their glucose levels start to rise and they get a diagnosis of type 2 diabetes. And then the doctors give them medications to try to get the failing beta cells to push out more insulin, or they give them insulin. And insulin is a growth promoting hormone. It's a fat storage hormone. It makes you gain weight. It actually promotes angiogenesis, which means the growth of blood vessels to fuel the growth of fat. And in doing so, insulin's angiogenesis promotion can permit or accelerate the growth of tumors and cancers. So excess insulin accelerates aging of the brain, increases your risk of cancer, and can even increase the deposition of atherosclerosis on the body. So in the type 2 diabetic, giving them more insulin or more drugs to make them produce more insulin to lower their blood sugar is not always favorable. It's most favorable if we can give them an anti-inflammatory, low glycemic diet, have them lose weight, and even in some of those cases, we've seen beta cell recovery in some of my type 2 diabetics who have lost weight and on a high nutrient diet, and seen some of those hibernating beta cells that are not dead yet actually recover, and their C-peptides and the measurement of the insulin production actually went up as the glucose goes down, as the weight goes down. But I think it's more generally accepted that it's possible to make a type 2 diabetic cured or get them back in total remission, because we even know some cases of a gastric bypass or lap bands who lose a lot of weight and their diabetes goes away. So doctors are starting to accept the fact that these cases are more possible. So I wanted to submit these cases on type 1 diabetics to show them how important it is to do this with a type 1, not just with a type 2, and that even in the very early stages, it's possible for a type 1 to reverse it. But even in a later stage of type 1 diabetic, almost all the type 1s across America, their doctors are giving them as much insulin as they need to control their glucose levels adequately, letting them eat an American diet, letting them require almost any amount of insulin, which causes the type 1 to become overweight, which increases their insulin requirements. And the heightened insulin requirements in the type 1 dramatically is shortening their lifespan, causing increased morbidity, blindness, kidney failure, aging of the brain, depression, high rates of cancer and early heart attack deaths, and peripheral neuropathies, the buildup of advanced glycation end products. I know I'm talking fast and saying a lot right now, but the bottom line is I'm saying that the conventional treatment for type 1 is not safe because they're not having their diet controlled adequately, and doctors are overprescribing insulin, thinking that that's okay as long as their glucose is okay. And I'm saying it's not okay just to have an okay glucose. You have to keep a high level of phytochemicals in your tissues. You have to keep a favorable weight, and you have to use a moderate amount of insulin when you're type 1. And be careful you're not requiring too much insulin, because the requirement of too much insulin to control your blood sugars can accelerate aging and increase your morbidity and mortality in type 1 diabetes.
Wow. So really, just kind of going back to the beta cell function recovering, I always tell my patients that those are the beta cells in the ICU. So we're going to try and get them out of the ICU. They may not be working right now, but maybe we can. So that's kind of a visual for those who may be questioning what that means exactly. So now you had these 3 cases, and you had the 3-year-old that was started on the diet within a month of diagnosis and started having decreased actual antibody production. And you go on and explain the type of diet they're eating, which is all the foods that we just talked about before, the 6-year-old. But then you also had this, which is a little bit later, it had the diagnosis for a bit. But I really want to focus too also on an older gentleman who had a diagnosis of type 2 diabetes, but then also found to have type 1. Because I think this is an increasing number of diabetics, or type 1.5 or 1.5 diabetic, because I don't think we understand, even there's some physicians who are not fully educated on understanding that you can develop this autoimmune component like a type 1, even if you start out as a type 2. Can you give us a little bit of insight into how that works and what you're measuring? Like, what should someone maybe go ask their physician if they're a type 1 or type 2 that hasn't been well controlled, and like, what are those lab tests, and what lab tests would you monitor in these patients that you saw get better? Like, what was happening?
Right. Well, this gentleman who was the type, he was really a fully type 1 diabetic that developed in his, a little older than most type 1s develop. So he had the antibodies, he had the autoimmune attack on his pancreas. And we were discussing earlier that an autoimmune disease can develop from bad health and bad nutrition. So it's the risk of developing lupus and psoriasis and even type 1 diabetes can be influenced by the quality of your diet and in regard to these children, perhaps by the quality of the parent's diet before conception or before and during pregnancy even could increase risk of autoimmune disease. We know that parents who eat poorly have children who have a higher rate of developing autoimmune disease. And there's some genetic predisposition to develop autoimmune disease. So there's a lot of factors involved here. But as you and I know, that even with genetic predispositions, with optimal nutrition, the body still has the ability and can repair broken DNA cross-links, or it can suppress the expression of genetic defects. It can kind of do things to overwhelm, nutrition can overwhelm even genetic tendencies. So in this case, this gentleman was an anesthesiologist. He was a physician at the local hospital. And he was consulting me because he was concerned about his career because he couldn't focus on doing surgeries anymore in the hospital because he'd be getting fatigued and falling asleep while he's trying to control a person's anesthesia. It's going a surgical procedure, and it was ruining. And he was thinking he was had to quit his career because he was having highs and lows requiring too much insulin. And so he had the foresight to come to me as the nutritional specialist in the community at the local hospital. And I discussed with him how much better he could get. And he became so, over the time that I cared for him as a patient, he lost weight. He'd come in and he showed me his six-pack. He actually lost, I think, about 40 pounds. He'd pick his shirt up and show me, that he now has a six-pack. And he's lean and how much physically fit he became. But the bottom line is that he was able to go back to his job again as an anesthesiologist and a physician who wanted to help people. And so he was able to go back to work again because he didn't require as much insulin and he no longer had highs and lows. Because I teach my type 1 patients that we don't want to moderate the insulin to the diet. We want to give you a regimented amount of insulin each day and keep you on that same amount of insulin all the time. And maybe your amount of insulin you're taking is 4, 4, and 4, and 6, 4, 4, 4 short acting with meals and 6 to 8 long acting at night. Your total taking 22 for the day. That's your limit you're allowed to take, and you've got to adjust your diet and keep your sugars controlled, not requiring more than that insulin. Let's say, I'm giving as an example here. Mm-hmm. So he had to control his sugars with his diet, not by pushing more insulin up. So then he loses weight, he gets fit, and his body stops requiring so much insulin, and you don't get lows. Now you can go out and exercise. Now he can go do a surgical procedure where he's stuck in the OR for 4 to 5 hours not eating, and he's not going to bottom out his blood sugar because he's not overtaking insulin. It gives him his life back because now he's requiring a physiological amount of insulin, or the amount of insulin normal people use, not a person that's insulin resistant requiring a huge amount. So type 1s become insulin resistant. And even though the pancreas is not producing insulin, they're still becoming insulin resistant. And now they require more exogenous insulin because fat blocks the uptake of insulin, and saturated fat in particular penetrates into the caverns, these caves in the side of your cell membranes, and the saturated fat blocks the lock and key mechanism. So when you have more butter, coconut oil, meats in your diet, the high glycemic carbohydrates now become more, you need more insulin to cover them because now you've hurt the lock and key mechanism where insulin is turning on, isn't allowing the glucose to go out of the bloodstream. So it's the whole dietary model that Americans eat, hamburgers, pizza, mac and cheese. We do everything wrong in this country. We have too much animal products, not just animal protein and animal fat. We have all these processed foods that don't contain nutrients in them that are high glycemic. And then we have a too low amount of the natural, colorful plant foods that contain all those antioxidants. And we get them all, and the American population is only eating 2% of calories from vegetables, 2% from vegetables. And vegetables are the key to successful health. No matter what you have wrong with you, you have to eat a lot of vegetables. So we get these people to like vegetables. And so many of them say, I hate vegetables. And I say to them, we're not asking you what you like right now, because eating what you liked is what got you into this problem to begin with. So we're going to eat what you have to eat to get well, but I will prove to you that I can teach you and make you like it by changing your taste buds over time. But right now, you just have to eat what's going to get you well, and don't evaluate it whether you like it or not, because your decision of what you thought you should eat and what decision what you like to eat is what got you sick. Now you got to eat the foods that are going to get you well, and we're going to only test this out scientifically if it can work, is if you really do 100% what I'm asking you to do. You can't do some modified version of what you think you feel like doing, what you want to eat. And then what happens over time is they get well and they start to like it more and more. And they don't just learn the recipes, but their taste buds get stronger and their taste preferences change. And then we've solved the problem.
I like that. I'm not even going to ask you what you like, right? So I'm going to use that with my patients. Like, I didn't ask you what you like. This is what you need to eat. So that's actually the approach I think parents need to take with their children, right? It's like, it doesn't really matter. This is what you can eat. You either eat or you don't. So that is wonderful. And is there any last little bit you'd like to share about these cases before we're closed?
Oh, I have to share something. Yes, it's that you wouldn't believe how enthusiastic and excited these children are with type 1 diabetes. I have other children with type 1 diabetes, because you'd think like the type 1 diabetic child is going to hard to get them to eat a healthy diet. No way, Jose. They are so into it. They don't like they are so into it. They're like scientists, these little kids, and they know, so they come into me and when they start this diet when they're young, they start learning the recipes. They know how to make the hummus with the real sesame seeds instead of the whole sesame seeds. They know the nuances of eating more, what I mean, the beans, so they know they have better sugar readings from it, and they really like eating this way. They haven't been tainted, and they haven't developed food addictions yet. And it's easier for these kids to eat healthy than it sometimes is for people who have heart disease and diabetes when they're 60 years old and 40 to 80 pounds overweight. I'm amazed by how the intelligence and the desire and the ability to enjoy doing this in children who have these conditions, who need to eat healthy. And I tell them, you got to get your parents to eat healthier, because they got to eat what you're eating, because you want them to be healthy too. You know what I mean? So it's the kid. So I just have to say that how cooperative and enthusiastic the children were to eat healthy, to control their illness and to get well.
Right. So I think that's wonderful. So you're giving the children the job to get the parents to eat healthier.
Exactly.
That's great. That's fantastic. Well, thank you, Dr. Furman, for your time and sharing your insight and wisdom with our folks and sharing your cases with us today.
Thank you so much. Thanks for the work you're doing too. Okay, we're done.